We will talk about a disease that has been on everyone's lips lately, which almost everyone has when an ultrasound is done. Liver fattening. What is this liver fattening? And how can I treat liver fattening in 7 steps? How can I prevent it without medication? We will discuss this. I claim that if you follow the 7 steps in this video, there will be no trace of liver fattening left. In fact, liver fattening is an umbrella term for us. What we mean by umbrella term is this. It is a general diagnosis that brings together many causes. Liver fattening is divided into 2 categories in medicine. Non-alcoholic liver fattening, meaning liver fattening not related to alcohol, or alcoholic liver fattening. For example, in America, the most common cause of cirrhosis is alcoholic liver fattening, while in Turkey, the most common cause is non-alcoholic liver fattening. So, liver fattening can indeed lead to cirrhosis. But is every person with liver fattening at risk for cirrhosis? This is definitely not true. Liver fattening is a reversible condition. If it is reversed, the risk of cirrhosis will disappear. However, if inflammation called steatohepatitis occurs on the basis of liver fattening, it will manifest itself in liver values. We can see this in the blood count. If this inflammation occurs, it means that the progression to cirrhosis has started at a rate of 10%. So, if liver fattening remains at that level, and you treat it with lifestyle changes, you can completely eliminate the risk of cirrhosis. But if precautions are not taken, cirrhosis may appear at the end of the road. We divide liver conditions into 3 stages: grade 1, grade 2, and grade 3. Being at grade 3 will really accelerate the progression to cirrhosis. If you also have grade 3 liver fattening, make sure to apply the 7 steps in this video to yourself. 1. Lose your excess weight. Just as our body gets fat and we gain weight, liver fattening is also a state of the liver gaining weight. It is the enlargement of the liver, and the most common cause of liver enlargement is liver fattening. If the body gets fat, the liver also gets fat. The liver is like a mirror of the body. If you consume too many carbohydrates in your diet, if your calorie intake is very high, and if you are inactive with low exercise. If you continue to live this way, just as your body gets fat, the liver will also get fat. Therefore, we definitely recommend reducing the fat around the waist for liver fattening. In fact, if possible, we want a weight loss of 7% to 10%. So if a person comes to me weighing 90 kilograms and has fat around the waist, if a patient says, I want to fully treat this liver fattening, at least a 10% weight loss is necessary for this person. This means they need to go from 90 kilograms to 81 kilograms. As you lose weight, the liver will also shed its fat. As you lose weight, your liver will also lighten. Secondly, the Mediterranean diet. The Mediterranean diet is one of the most extensively studied, most researched, and most proven beneficial types of diets throughout history. The Mediterranean diet is not a miracle diet, it is a rainbow diet. This diet is plant-based, but also includes animal foods ranging from dairy products to meat and eggs. However, the Mediterranean diet treats liver fattening, even if you cannot lose any weight at all. Studies show this. When you switch from a carbohydrate-heavy industrial diet to the Mediterranean diet, you can really treat liver fattening even if you can't lose weight. What is the Mediterranean diet? This is a general term for us. You can find the steps of the Mediterranean diet on our websites, but what you need to know is this. There are absolutely no processed foods, absolutely no sugar, and minimal carbohydrates. High carbohydrates and excessive grain consumption will lead to liver fattening. Processed foods are toxic. They will increase the risk of liver fattening. Thirdly, drinking coffee. Drinking coffee really reduces the risk of liver fattening. I even mentioned this in my previous posts. If I were to be stranded on an island, and if I were offered only one drink, I would choose coffee, because if coffee consumption is more than 2 cups, it can slow down the progression to cirrhosis in alcoholic or non-alcoholic fatty liver by 90%. This is a miraculous figure. By consuming only coffee and taking the beneficial bioactive compounds in it, you can significantly prevent the progression to cirrhosis. And in patients, especially those with liver fattening, if there are no symptoms related to coffee, such as palpitations, rhythm problems, or reflux-like complaints, I generally recommend coffee consumption. But remember, coffee should be filtered and consumed at the right time and in the right way. Please don't forget to watch our video about coffee. Fourthly, be active. Don't remain sedentary. Get up. Take long walks. Do cardio-focused exercises for 45 minutes, 4 days a week that will increase your heart rate, connect you to life, and boost your endorphin and serotonin levels. Swim, play tennis, shoot basketball, play matches, lift weights. Just do it. Sedentary lifestyle is one of the most common causes of liver fattening, and as you exercise and become active, liver fattening will resolve on its own. In fact, even if you don't make a huge change in your diet, as you increase your walking distance and do brisk exercises, your liver fattening will improve. If you want to do brisk exercises, I recommend consulting a cardiologist first, because if there are many risk factors, I suggest you consult your doctor to get approval for brisk exercises. Fifthly, sugar. Sugar is the most common cause of liver fattening in society. It is excessive carbohydrate consumption, especially processed carbohydrates. An individual with liver fattening should not continue consuming sweets. They should not still be consuming bread in front of every meal. They should not consume pasta. Especially, they should avoid foods like baked goods, cakes, pastries, and buns. You may see liver fattening as just fat accumulation, and you may often blame fats. But carbohydrates are a much bigger culprit. You consume healthy fats, the liver will no longer have to produce fat. It will use these. But as you consume carbohydrates, the body will convert them into triglyceride form and store them around the liver as excess calories. As you consume carbohydrates, your liver will become fatty. Healthy fats reduce the risk of liver fattening. As you consume sweets and sugar, you become ill. Fats like butter and olive oil reduce the risk of liver fattening. But those vegetable or refined oils that are reservoirs of omega-6, like sunflower oil and canola oil, are toxic fats. These are reservoirs of omega-6 and increase the risk of liver fattening, inflammation, and cirrhosis. Even if you have fatty liver, you can seriously protect yourself from liver fattening by simply changing the type of oil you use. Sugar. What is that? Someone with fatty liver should not consume sugar. They should reduce bread consumption to a minimum. They should not eat rice every day. They should not consume carbohydrates. Carbohydrates should be less than 20% of the total daily calories. If possible, you should also reduce the consumption of grain products. Excessive consumption of grains will increase the risk of excessive carbohydrates and fatty liver. Sugar and simple carbohydrates should be eliminated from your diet. Sixth, manage your stress. Teacher, you mentioned fatty liver and stress. Don't say what is the connection. Stress means an increase in cortisol after stress. Cortisol means an increase in blood sugar in the body. Blood sugar means insulin. An increase in insulin means insulin resistance. It means metabolic syndrome. And one of the most common causes of fatty liver is stress. A stressful life causes emotional hunger attacks since the cortisol level in the body will remain constantly high. This increase in blood sugar will lead to rapid fat accumulation in the body, and it will lead to the consumption of junk food. You should manage your stress. Your sleep pattern should be good. What I mean by stress management. When stress comes to you, it's not about saying I will manage it, but rather taking additional measures for yourself. I'm talking about grounding, doing forest bathing, paying attention to your sleep pattern, exercising, reading books, taking cold showers. No one can manage their stress out of the blue. Please watch our video on stress management. Learn how to manage stress in the best way in 10 steps. Yes, I have arrived. Although it is not consumed frequently in our country, alcohol and cigarettes are the most common causes of fatty liver abroad. Alcohol consumption is one of the most common causes of fatty liver. However, the relatively low alcohol consumption in our country causes a difference in the type of fat accumulation. Fatty liver development due to alcohol consumption significantly increases the risk of liver inflammation, known as steroid hepatitis. In other words, if a person experiences liver fattening due to excessive calorie and carbohydrate intake, the risk of liver inflammation and progression to cirrhosis is much faster for someone with alcoholic liver fattening. And there is an important point to consider here. If liver fattening develops due to nutritional lifestyle disorders, this stage will gradually progress to cirrhosis. Stage 1, Stage 2, Stage 3, but if you have alcohol-related liver fattening, it can progress directly to cirrhosis without fitting into any of these stages. Especially if you have alcohol-related liver fattening, know that your risk of cirrhosis is much higher. The risk of cirrhosis is not to be underestimated. Although the liver is an organ that can renew itself, cirrhosis is the failure of the liver to perform its functions. It means that the body's main cleansing organ is unable to function. Believe me, you do not want to have cirrhosis. If you have liver fattening and alcohol in your diet, we should no longer be discussing this. Alcohol should no longer be a part of your daily life. If you are experiencing serious issues related to this, or if you have an addiction, you can seek support. Don't say, I drink 2 glasses every day, I drink once a week. If you have developed alcoholic liver fattening, you must eliminate alcohol. If possible, you should seek support. Again, smoking is one of the factors that increase the risk of liver fattening. Smoking means oxidation. It means the formation of free oxygen radicals in the body. This can lead to increased stress in the body, vascular damage, and liver fattening. By following the 7 steps I mentioned in this video, you can completely protect yourself from liver fattening. If you have liver fattening, you can treat it. And remember this, there is no medication treatment for liver fattening. The biggest treatment for liver fattening is lifestyle change. We cannot say, doctor, give me a medication to make this go away. For example, if a patient is diabetic and has accompanying liver fattening, the use of metformin can partially reduce this fattening. However, in normal individuals, if there is no sugar-related condition, such as hidden diabetes, the administration of metformin will not significantly change the situation. Every path leads to diet, every path leads to exercise. In fact, my recommendations throughout all the videos are generally similar. And health generally follows the same path. Please apply the 7 steps in this video. Eliminate liver fattening. Goodbye.